we're reviewing the medical record.
You might talk louder because my whole mic is on the thing.
We're reviewing the medical order for the procedure for the dressing change. We are gathering our supplies and we got them at the bedside. We've cleaned the bedside with a antimicrobial wipe. We're allowing to dry. We're going to perform hand hygiene and provide privacy. We're going to identify the patient.
What's your name and date of birth?
What's your name and date of birth? We're going to explain what we are going to do and why we're going to do it. And we got to change your dressing for your port. It's to minimize infection. Do you have any allergies to tape or any skin antiseptics? We're going to adjust the bed to a comfortable working height and put the waste can at a convenient location.
Okay.
Okay. The patient's already in a comfortable position. And then we're covering any exposed area. We're going to apply our mask.
I'm not really putting this on.
Okay. And then we're going to give the patient a mask. Okay.
They're masks. They're masks. Oh,
We've got the bedside table within easy reach. We're setting up our sterile field and we're opening our supplies and dumping them on the sterile field. If there's a fluid infusing, we need to interrupt it while we're changing the dressing and apply a slide clamp on the lumen. Okay, clamp. We're gonna put on some clean gloves. We're looking at through the old dressing to see if there's any sutures at the top. I don't see anything.
take off the old dressing.
Let's see. We're removing the old dressing.
Is there an extra circle over there?
I don't see one.
No bio patch. Do you have an extra bio patch? Okay, this is gonna be pretend bio patch. Okay.
Can't get the dressing off.
It's okay if it's all up there.
Applying the dressing in a perpendicular to the incision site. We're discarding dressing, removing gloves, and discarding and performing hand hygiene. So then we are going to put on sterile gloves.
Okay. These are my sterile gloves.
And using an alcohol swab, we are starting in at the incision site. And we are going in a circular motion from in to out.
Okay.
Okay. Alright. We're wiping off any old blood. We're going to allow that to dry, and then we're going to use the chlorhexidine swab, and we're going to scrub vigorously back and forth for at least 30 seconds, covering 2 to 3 inches of the area. We are not going to
Blot
or blot,
yes.
but we are going to allow it to dry completely.
Okay.
Okay, we're going to apply our bio patch.
Look at mine.
Mine's kind of tiny.
Look at my bio patch.
Now, when we put this on, we gotta make sure that it's at like a 2 o'clock motion.
Okay. Skin prep.
Then we're gonna apply our skin prep. And we're going to allow that to dry. Then we're gonna stabilize our catheter with our non-dominant hand. And we are going to apply our dressing.
Wow, these are super old. Cool. Wow, look at that. This won't even come off. That's okay. Alright.
Okay. So after we do that, we are going to measure from the bottle patch to the end of the tube and make sure that it's not come out. Okay. And then we are going to remove an end cap. We're going to remove the end cap. We are going to cleanse the end of the lemon with an alcohol swab.
Open the port.
And then we are going to open the port and flush.
Do we have to aspirate first? Don't think so.
They don't say
Okay.
that. So we're going to cleanse the end of the cap. We're going to attach the flush. We're going to, yes, aspirate.
Okay.
We get blood returned, then we're going to flush.
Okay.
Okay, so then we're going to remove, or we're going to clamp and remove the syringe. And then we're going to remove the extension. We're going to clean the end of that cap vigorously for 30 seconds. Then we're going to replace it with a new one. We are going to scrub that one. And we are going to flush it. Right. And then we are going to close that thing back and put a clean cover in it. We're going to do the same thing for the other side. We're going to clean the end of this cap vigorously. We are going to open the clamp. We are going to flush. We're going to close the clamp. We're going to take this cap off. We're going to clean vigorously.
Only have one port.
You do have, you've got the 3 one, except on the
It's
one.
up here. Uh-oh.
After we clean that, we're going to place with a new hub. We're going to clean the hub vigorously, then we're going to open and flush that one. Close back, clamp. We're going to clean it, and we're going to put a clean cap on that hub. Okay. And then we are going to label the dressing with the date, time, and change the initials. And then we're gonna resume their infusion. We're gonna educate why it's safe for them to safeguard that site. And we're gonna remove our equipment, ensure patient is comfortable in the lowest position in the bed, and remove PPE, perform hand hygiene, and document the dressing change.